As we age, our tendons go from this to this. And that's because as we get older, tendons tend to lose blood flow and water, making them more susceptible to injuries. Now, the Achilles tendon is one of the most common tendons to injure, especially if you're middle-aged and a mid to long distance runner. So, in this video, I'm going to share with you a few things that will help to significantly reduce the healing time of your tendon injury, of your Achilles tendon injury. I'm going to share with you my favorite widget that I recommend to all my patients that reduces impact and thereby reduces healing time. I'm also going to share with you and do the step-by-step a self-taping technique, very efficient, and this tape creates an additional Achilles tendon which takes the pressure off your own Achilles tendon, so it facilitates healing. And lastly, what I'm going to do is I'm going to share my favorite home therapy with you using a tool you find in any household and some stretches you might not have seen in different videos yet. All right, let's get started. So what is Achilles tendonitis? Achilles tendonitis is essentially an inflammation of the Achilles tendon, which is located between the heel and your calf muscle. And you'll find a redness, a swelling, a tenderness to touch in that area, and you're probably struggling with an Achilles tendonitis. It's a very common condition, especially amongst middle-aged people who love to run, middle distance, long distance, seem to be especially susceptible to Achilles tendonitis. Don't leave it untreated. It might result in a total rupture, which is obviously something you want to avoid at all costs. But if you treat it timely, then there's often no need for surgery. You need to be a little bit patient though, because it might take up to 24 months for an Achilles tendon to heal. So this is the first thing I'd like to demonstrate to you. This is this gadget I was talking about. It's a silicone heel lift, 5-6 pound online. As you can tell, made of silicone. It essentially does two things. First of all, it raises your heel a little bit, thereby shortening the Achilles tendon and giving it more opportunity to heal. Secondly, it acts as a shock absorber, like a cushion. So when you're walking, the impact of when your heel comes down doesn't go straight all into the Achilles tendon, but is being partly absorbed by the silicone heel lift. So the aim of this tape is to create an additional Achilles tendon, an artificial Achilles tendon that helps to take the pressure off your own Achilles tendon. And I absolutely love this tape. It's simple to do, it's very efficient, and my patients absolutely love it. So the first thing you need is obviously you need to get some tape. I mean, you can get it online, you can get different brands. They're about £5 a roll, so that's what you need to get. Make sure the tape is about 5 centimeters wide when you get it. Obviously you need some scissors to cut the tape, and this is what you need. You need about 3 strips of about 30 centimeters in length, which equals about 12 inches. So 3 strips of these. Then you need about 3 strips of about 15 centimeter in length, and you need 2 smaller strips. They're probably about 5 centimeters in length. Now, as you can see, what I've done with this tape is I've cut the edges and made it nice and round. And that prevents the tape from rolling up after you've applied it. Okay, let's get started. So let me demonstrate this tape to you. Okay, so we start off with the longer strip. This is a 30 centimeter strip. And what you do is at the end, see this paper at the back, you can pull that off. So you start off with that. Now you pull this bit on your heel. So make sure that you stand on your toes. You want to shorten the Achilles tendon, so make sure you stand on your toes. Yeah? Then you pull the back off and you slide it up the back of your leg. There you are. You take the second strip. Same thing, the 30 centimeter strip, the 3 long ones, what we're doing first. Again, you put the tape on your heel first. Yeah? Make sure there's no folds in your heel, because it can get a little bit annoying with walking and stuff and irritating. Same thing here, stripping the back of your leg, like that. And then we have the third strip, same thing. So I'm taking off edge here, and I'm bringing it on, starting on the heel, and I'm going a little bit more to the inside of my calf. There we are. And this tape has got a little bit of elasticity in it, so you need to pull it a little bit, take the slag out a little bit of this tape. So that's it. Now I'm going to fold these outer bits in. So you can see already I'm creating a little bit more of an Achilles tendon, helping to take the pressure away from your own tendon. Now I've got these shorter strips, these 15 centimeter strips. They're called anchors. We're going to use them as an anchor to make sure that the tape stays put where it should be. So as you see, I broke it in the middle. I'm now pulling the sides apart here and going over the top of the tape. There we are, just to make sure that it doesn't come off. Second one, same thing. So I'm pulling in the middle, pulling it apart, and you are getting the side bits out. There you are, other side, there you are. Folding it back, having the opening the side there, on top. One, and two. There we are. And the last one, same again, pulling the side bits out, going on here, and the side bit here. There you are. Now I'm taking one of my shorter strips, the one that I've also made the edge a bit round, pulling it, and this goes underneath my heel. So that's an anchor, essentially trying to prevent the tape on my heel from rolling up. There you are. And the last one, got a little strip here. I didn't bother to cut this one. Reason being is I'm going to use this to tie up the official Achilles tendon. See, I'm going to literally just touch it on the outside. There you are. I'm going to roll it up. Look, come in. There we are. And create this Achilles tendon. So here we are. I've now created this artificial Achilles tendon, and it takes the pressure away from your own Achilles tendon. Now, you should leave this tape on for about 5 days. It's waterproof, so it should be able to resist showering and stuff. I would normally recommend just to put a little, obviously a plastic bag or something around it, just to make sure it stays on. So 5 days is how long you can keep it up for. Do shave your legs, because it gets obviously a bit sore for you if you take it off, and that should really help with the Achilles tendonitis and improve recovery. So far I've shared with you the silicone heel lift and the Achilles tendon tape. I hope you found value in that already. I'm going to share with you my favorite home therapy using tools you can find in any household, and my favorite stretches, probably 1 or 2 of them you haven't seen anywhere else yet. Before I continue with the video, I'd like to ask you for a little favor. Would you mind giving this video a thumbs up, leaving a comment in the box down below, and subscribing to my channel if you don't mind. Okay, let's continue with some of my favorite home therapy and some exercises. This next technique is the first one in our home therapies, and it's called cross friction. And what it does is improves the blood supply to the tendon and thereby reducing the healing time. Now, it can be a bit sore. What you need to do is grab your Achilles tendon between your thumb and your index finger, and you make rolling movements up and down the tendon. And you do this for a couple of minutes. But be aware this is going to be a little bit sore. Yeah? And you repeat this 3 to 4 times. You can do it twice a day, 3 times a day. It's absolutely fine. Another area which is also quite sore in the Achilles tendon is when the tendon inserts to your heel bone, which is about there. That might be a bit sore as well. So you want to use either 2 thumbs to do cross friction on this area there, or you could use the back of for example, a kitchen knife, and do it this way, and you save your thumbs that way. And it's again same thing, couple of minutes. You make circular movements around the areas of tenderness. Definitely you're going to feel this, and again it helps to improve the blood flow and decreases the tissue healing time as well. So the first stretch I'd like to demonstrate to you is the dynamic calf stretch. And what you need to do is stand with your hands against the wall, push the affected leg back until you feel the calf stretch, lift your front leg up and swing it left to right in a controlled movement. Now you should be feeling this extra stretch in the calf muscles. Perform for 30 seconds and repeat 3 to 5 times. So the next exercise I'd like to share with you is what we call eccentric loading, which is a fantastic exercise for tendon injuries, and I'm going to demonstrate the one you need to do for your Achilles tendon. So you need to start off with standing on your toes, on the ball of your foot, so use the stairs or use a step to stand on your toes first, and then very slowly lower your heels below the parallel. So you should feel the stretch now in your calf muscles. Hold this for 20 to 30 seconds and repeat this 3 to 5 times. Now this next bit is important. When you go to standing on your toes again, do not use the affected leg. So use the banisters of the stairs to push you back up again, or use your good leg to come and stand on your toes again, but don't use the leg that you're trying to stretch out. So here you are, my top tips for fixing Achilles tendonitis. I hope you found a lot of value in this video. If you did, don't forget just to give me a thumbs up or leave a comment, like our channel, subscribe to our channel. I'd really appreciate it. People who struggle with Achilles tendonitis often also struggle with plantar fasciitis. Check out our channel. We've done a fantastic video on exercise to do for plantar fasciitis. Which I'm sure you find very beneficial as well. Another factor in the creation of Achilles tendonitis could be faulty running shoes. Done a video, 4 tips to find the perfect shoe. Simple video, simple tips, really useful, so check that out as well. Good, for now, take care of yourself. If you can, take care of someone else too, and bye for now. Bye-bye.